Or Tacey's time.
Yeah, give us a call, 347-766-4323. Leave your voicemail questions. I don't care how stupid they are. We need a lot more
We
questions.
will answer them in less than 3 minutes.
If Tacey is going to enforce this bullshit policy of hers. All right. There we go.
I have this pressure beneath my eyes and the bridge of my nose. And
we did this one.
We did?
Yeah, last week. Yeah.
Okay. Damn it. Okay. All right.
Yeah, we'd like to have a follow-up on that guy, though, to see how he, if he did go ENT or whatever.
Okay. How about this one?
Hi, Dr. Steve. My name is Jeff. I've been diagnosed with Castleman's disease, and I'm not really sure exactly what that is or what I should do more about it. I had surgery on my neck to remove the lymph node, and nobody around in this area seems to know anything about it. Just be interested in your opinion on it.
Yeah.
I appreciate it. Thanks. Bye.
Okay. We usually try to, avoid rare diseases and stuff on here because it doesn't have a real, general interest. But in this case, particularly Castleman disease is an extremely rare disorder that causes lymph nodes to enlarge. And these people will often think that they have lymphoma or something like that, but they actually don't. And sometimes you can have just one lymph node in the chest or the abdomen, then they'll have this thing called multicentric Castleman disease. It's lots of lymph nodes throughout the body. And now if they have lots of lymph nodes, they can have fever, weight loss, fatigue, that kind of stuff, all things that, again, would make you worry about having lymphoma. This isn't contagious. It affects people of all ages. And there is a treatment for it called siltaximab. And it takes care of the majority of cases and induces remission in almost everybody. So check that out. You would still want to see a hematologist because they're really the only ones that deal with that stuff, with the monoclonal antibodies, and there you go. So Castleman disease, pretty interesting syndrome, and but they usually do very well. And if you have the unilateral or the unicentric one, where you just have the one lymph node, and they remove the lymph node, you're fine.
Oh, good.
All right. Okay. It does need to be treated. In really bad cases, it can lead to some problems down the road, including infections, organ failure, stuff like that. So
and suppressed immunity.
Yes.
Yeah.
All right.
Okay. Oh, 1 minute, 6 seconds.
Hey, Dr. Steve, how are you? I'm in my late 30s now, and everything hurts all the time.
I'm ignoring you, Tacey. So
I'm not complaining, that much. But the question that I have for you is, why is testosterone, HGH? Why are these things illegal? Bodybuilders get it all the time.
Okay, we've answered this question before, but it's a good question. And the reason they're not illegal, they're just illegal to obtain without a prescription. And the reason is that there are downsides to it. Testosterone is a schedule, is on the DEA drug schedule. It has to be prescribed. And, I've seen people that did the cycles for bodybuilding and then ended up with a testosterone of 0, literally 0.
Jeez.
Because I've never seen it in anyone other than somebody that was juicing.
Right.
And they end up with a suppression of their of the shit. Andy, don't use this one on our shorts. They end up with a suppression of the testicular function, and the testicles just shut down. They go, why are we even here? There's plenty of testosterone in our system. And so they just go to sleep, and then sometimes they don't wake up.
Yes.
Testosterone of 0. So you can imagine, we talk about low testosterone on this show, what a testosterone of 0 would look like. So you don't want that. Then there are other things like, roid rage is a thing. Acne is a thing. increasing your risk of heart attack and stroke is a thing if you get those levels too high for too long. So, I mean, we can argue whether people should have agency to do what the hell they want to with their bodies. I'm in favor of that, but I'm just explaining why these things currently are illegal.
Mm-hmm.
Okay.
Yeah. Did he say anything else about why he has aches and pains all over?
Oh, yeah. No, I'm wondering if he thinks he has low testosterone. You know, it's perfectly legal to treat that.
Right.
If you have low testosterone,
it's a pretty easy test too.
You go get tested and you get treated. And if the prescription stuff is too expensive, go to a compounding pharmacy. They can make you testosterone aftershave and all kinds of stuff for about $50 a month. All right. All right.
All right, guys.
41 seconds.
Oh, okay. Well, could you hear the music? We're
over time.
We're stopping anyway, but thank you, Tace. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Time.
Time.
All right. That'll be a fun ending. Okay. Okay. You got some stuff from the Fluid family?
I have one good question. Yes.
Okay. Do you have any? Okay. We got to do the gifted membership. So SG Fanboy did 10. And okay. And I don't see anything else. Okay.
Dan Mullen to $9.99. The very last thing.
Okay. Yeah. Hang on. Let me start the recording back up.
Sorry, I don't know.
That's okay. You're fine.
What to read.
You're fine. All right, Dr. Scott, let's check in from the Fluid family. Myrtle Manus.
Myrtle.
Gifted 20 Weird Medicine Dr. Steve
Wonder who she is.
It's my girl.
Blah, blah, blah. See, that's the things that are coming out of your mouth, Chad. Babbling, insanity, delusions.
Oh, God.
Okay, SG Fanboy gifted 10 Weird Medicine with Dr. Steve memberships. Thank you, my friend.
This is not how sane people act.
No, it's not. But thank you anyway. And what do you got, Dr. Scott?
I've got a question from Diesel Child.
Okay, I've got one from Larry Salty at 1:13 p.m. as well. That's so we need to make sure we get to that one. Okay,
well, you do that one. I'll do Diesel Child.
Okay. Well, it's hard for me to read and be on mic at the same time. So
I'm reading and being on mic. Diesel Child.
Okay, but look at the way you're fucking looking at that, and look at the way I have to read.
Oh, mic positioning. It's all about mic positioning.
Oh yeah, what a weird concept.
Diesel Child. Can you talk about how taking saw palmetto helps with urine and prostate issues?
Yeah, sure.
How close is it to the actual prescription medications?
Okay, go ahead. I know what the urologists tell me. Go, you talk.
Well, I mean, the supplement has been used for many, many years.
Yep.
To work with urine and make it easier for you to urinate and hopefully shrinking some of the prostate. It's got some anti-inflammatory effects, and it's also got some anti-androgenergic effects, like you would use on somebody that's got like an overactive bladder.
Yeah,
and that's
so there are studies.
It's pretty safe. I mean, if it's used as directed,
right?
Yeah,
there are studies that show that saw palmetto is as effective in treating symptoms as finasteride, which is Proscar, without side effects such as loss of libido, which unfortunately you can have with finasteride. Yeah. About 10% of people will, because finasteride blocks testosterone at the level of the prostate, and also at the level of the hair follicle. Gotcha. But it's not supposed to do it everywhere else, but in some people it does. And there are some studies that suggest saw palmetto may actually shrink the size of the prostate gland. And this is coming from MountSinai.org. I'm not looking at the original studies. I'm just looking at their analysis of it. But, Mount Sinai is not some bunch of lunatics. Well, maybe, but they may be lunatics, but they're relatively empirically oriented. So, yeah, saw palmetto is pretty cool stuff. I'm not sure what the mechanism is. Do you?
Well, I think that's what they're talking about. It acts very similar to some of the pharmacologicals. That inhibition of let's see, it's got anti-adrenergic effects. It's got anti-proliferative.
Okay, so it does
effects.
block testosterone.
and at the 5.
Okay, 5
reductase.
alpha reductase enzyme. Okay.
Yeah, so much like a testosterone, blocking the testosterone production.
Yeah, that's interesting. So maybe it's just slightly more specific than finasteride is. We have 8 histamine blockers.
Mm-hmm.
Some of them are specific for H2,
Mm-hmm.
which would be acid in the stomach type stuff, and some are specific for H1, some are non-specific. So it may be that if doesn't finasteride work by blocking 5 alpha reductase as well?
I don't know.
Okay, well, let's look it up real quick.
Well, you have
Finasteride.
37 seconds.
No. We're in the second.
Let me look at the.
Oh, we made a new rule?
Finasteride is 5 alpha reductase inhibitor. So
It's very
it may
similar.
be that saw palmetto is simply more specific for the prostate.
Or maybe finasteride they took and made it out of saw palmetto. They teased it, which is possible.
Let me tell you the other thing, though, because finasteride works on hair follicles, and I've never heard anyone using saw palmetto for hair growth, I'm going to bet that saw palmetto, that we're right, it's simply more specific for prostate tissue than finasteride is. So there you go. Okay, good. All right, fair enough. Can you read the one from 1:13 p.m. by Larry Salty?
How are you seeing the time on these things?
Well, okay, it's all right. Hang on. Hi, guys. Question for the show. My wife has a clean bill of health regarding her vagina. Nothing wrong according to her gyno, but every time I go down on her, I end up with ulcers in my mouth. This could be I wonder what kind of ulcers. If they are aphthous ulcers, it may simply be a pH issue. And so one of the things that he could do is when he's going to, go eat at the Y, then afterward he can rinse his mouth out or eat yogurt even, but he could, the pH of the vagina. Let me see here. I'm trying to remember the pH of the vagina. I used to know this by heart when I was delivering babies. Okay, it's between 3.8 and 5.0, so it's very acidic. So what he could, I'm going to give him an idea. Take, say, a quarter teaspoon of sodium bicarbonate and put it in 8 ounces of water. That's going to create a very basic solution with a pH of around 8 to 8.5, maybe even higher. And after he goes down on his wife, he is to then rinse out his mouth with this. Don't swallow it. Just swish it around, rinse it really good for like 30 seconds and spit it out. Let us know if that works.